the lateral aspect, the medial aspect of the axilla, and also the posterior border. However, the posterior border will mainly be formed by trapezius. So obviously this then becoming the armpit that we know. So if we're to do it on me, this would be pectoralis major. Serratus anterior is there because it extends to the back, but obviously the trapezius muscles there as well. So therefore, all their surfaces in relation to one another end up forming what we know as the armpit, which is the axilla. That's important to mention. So this is pec major. And then now I'm just going to quickly look at the brachial plexus. So the brachial plexus really is a system of nerves that supply the upper limb. They supply both the anterior and posterior aspects of the upper limb. And the brachial plexus arises from the nerve roots of C5, C6, C7, C8, and T1. Obviously, C5, these are the cervical roots. And T is thoracic, the first thoracic nerve root. And in terms of saying the roots, what I mean is the anterior rami. And so if we were to think about the roots, say if this was the vertebra, I don't know why I cancelled it out. Anyway. And if this was C5, the rami of C5 and C6, so this will be C5, C6, C7, what we call C8, even though there is no 8th cervical vertebra, C8, and then T1. So this will be the posterior, or shall I use a different pen? So this will be the posterior rami, and this will be the anterior rami. And what happens, the roots of, that are all the pens that I have. No, I do have some more. The roots of, the anterior roots of C5 and C6 will join together, and the anterior root of C7 will continue on its own. I should have used a different pen. That was the whole point of grabbing some extra pens. So that of C7 will extend on its own, really. Only the anterior rami. And then the anterior rami of roots of C8 and T1, this is T1 there, will also extend and unite. Oh, I don't know if using yellow is such a good idea. I'm going to change yellow two, suppose red, because I don't think I will have any other color. So these two will unite. All these two, the anterior rami of these two will also unite. And the other one, I don't need yellow anywhere. And while I'm here, I might as well as say the posterior from C5, C6 and C7 will join together to form the long thoracic nerve. Thoracic nerve. So the union of the roots, so these are the roots. So the union will form the trunks. So these will be the trunks. And the trunks will have a superior, a medial, and an inferior trunk. And the inferior trunk arises from the anterior rami of C8 and T1. The middle one arises from the anterior rami of C7 only, while the superior one arises from the anterior rami of C5 and C. I apologize, I forgot to check the new pans to see if they can be seen clearly on the camera. I hope they can. But these are the trunks. So these trunks, as they extend towards the axilla, because remember we're coming from, if I was to borrow the model again, we're coming from, so these are the, the nerve roots that I'm talking about. So we are rising from deep there. So if so we're rising from there really and up to T1, which is just there. So the aim is to extend into the arm, so into the proximal aspect of the humerus. So we're extending more laterally, arising from that. So extending more laterally. So that's what I mean when I say extend. So as they extend more laterally, well, inferolaterally really, to the proximal aspect of the humerus, they are forming the trunks. And the trunks then have divisions. So the superior, medial, and inferior trunks will have divisions, which I'll use a red. They'll form a posterior division and an anterior division. And again, the medial as well, the medial trunk as well will do exactly the same. The inferior trunk will similarly divide into anterior and posterior. So this is just posterior. I think I'm actually going to change and have posterior in red and all the anterior in black. So this will be the anterior. So all the posterior roots, all the posterior divisions of the trunks are in red, while the anterior divisions are in black. So the superior, medial, and inferior trunks will then divide. So these are divisions of trunks into anterior division and posterior divisions. And then from that division, we will have the anterior branches, the anterior divisions of the superior and medial trunks will merge and as they merge, they'll form the lateral cord. So this will be the lateral cord. And then the anterior division of the inferior trunk will extend without merging with any other to form the medial cord. So these are cords here. And then all of their posterior divisions will merge together obviously it's much better, I suppose, to extend this into the medial aspect. So the anterior division of the inferior cord will form the medial cord, and then all the posterior divisions of the superior, medial, and indeed the inferior will merge together to form the posterior cord. And this and the cords are, you know, what are they're not really the terminal aspects, because the terminal branches are what we know as the radial, ulnar, median, musculocutaneous, and axillary nerves. However, these nerves, these terminal nerves, arise from the lateral, the median, and the posterior cords, and I will show how they arise later on when I present the arm and the forearm. However, what I wanted to say is that as they extend from under the clavicle, because they will extend under the clavicle, they become the trunks. So they arise from the axillary skeleton, and as they extend from under, as they emerge from under the clavicle, inferior to the clavicle, they are the trunks. So they are just trunks emerge from beneath or are overlaid by the clavicle. So as they emerge, they become the trunks, and as they enter the head of the humerus, that is when they are known as the cords. And the cords also overlay the muscles which are known the triceps, and indeed the muscle from the back, which is they overlay teres major as well, as they are extending into the arm, and latissimus dorsi, in fact, because latissimus dorsi is the overlays there, so they will overlay latissimus dorsi as well. So the names of the cords, knowing them as the medial, the lateral, and the posterior, are all relative to the axillary artery, which I'm going to present next. So the axillary artery, as it is emerging from the subclavian artery, or really from the neck, but obviously subclavian, it obviously will have relations. So it's lateral relation which will lie. So if it's coming towards me, it's lateral relation on its lateral aspect. Well, if it's like that really, on its lateral aspect there, we will have the lateral cord, and on its medial aspect, we will have the medial cord, and behind it, which really is mostly inferior, will be the posterior cord. So the names of the cords are based on its relationship with the axillary artery, and that then now brings me to discuss the axillary artery. But then really, while I'm here, I just want to obviously say that the cords are the building blocks, or really the building divisions of the nerves, which we know as the radial, the ulnar, the median, the musculocutaneous, and the axillary. And indeed, they all supply particularly the anterior divisions and posterior divisions will supply the anterior aspect of the upper limb and the posterior aspect of the upper limb. I hope I haven't forgotten anything in terms of just discussing how the brachial plexus arises. And then the next section really is the arteries. And the best way to think about the arteries, now that we have the entire, more or less the entire anatomy of the thoracic cage and the beginning of the upper limb, really, it's always best to then now think of the arteries in terms of where things are in the human body. So we'll have, it is a bit silly to have drawn this in red. Perhaps I should make it purple. So this is the manubrium of the sternum, and the sternum. To the xiphoid process. And obviously the sternum will then have the ribs, well, the clavicle there. And then the ribs. Rib 1, and then 2, up to 6. Obviously the costal cartilage is there. This is not really drawn to be anatomically correct by any means. It's just to emphasize a point, really. So we will have the ascending aorta, well, the aorta really as it arises. So this is the aortic valve, and the ascending aorta. So as the aorta reaches the opening of the thoracic cage, it will give off on the right the brachiocephalic artery, and then the left common carotid, and the left subclavian. And so we know that the brachiocephaly will bifurcate into the right common carotid. So this will be the right common carotid, and indeed the subclavian artery. So this will be the subclavian on the right. And the subclavian artery will obviously lie under the clavicle and emerge from under the clavicle there, will overlay the first rib and emerge. So nothing is redrawn anatomically correct. The subclavian artery will give rise to the vertebral artery, which will obviously go on to form the circle of Willis, and as well the thyrocervical, which again will then give off the cervical, the trunks into the cervical neck, indeed extending into the thyroid. The thyrocervical also gives off branches into the thoracic cage, the anterior aspect of the thoracic cage, and indeed the scapula. So there are important branches that are given, such as the suprascapular, and indeed the thoracic branches coming onto the thoracic curve, including the internal thoracic. And as the clavicle emerges from under as the subclavian emerges from under the clavicle, it becomes known as the axillary. And the axillary will extend into the so if this was our scapula there. And this is the humeral head. Well, the proximal humerus really. So the axillary will extend, and it will give off branches to the suprascapular. It will also give branches to which is called the circumflex scapula, again, which supply all the muscles of the scapula. And it will emerge and enter the arm. So so it will extend laterally. And there at the inferior border of pectoralis major, it gives rise to the brachial artery. So this now is the brachial artery. The brachial will have the dip. This is by no means anatomically correct. However, it's just to emphasize and show points. So the axillary artery will give rise to, I'm just going to get rid of the to the anterior, well, to the posterior really, posterior humeral circumflex, and indeed the anterior, I'm just going to remove the muscles just to make my life a bit easy, and the anterior humeral circumflex, which supply the proximal arm, the proximal humerus, and indeed merge together and also give the cruciate artery, which lies in the intertubercle fossa. So indeed it will end at the inferior border of pec major. And it will also give the muscles into the scapula. So it basically looks something like similar to that. This has been stretched out really to try and show. I suppose I could have worked a bit better and had the scapula there, and then had these branches much more proximal. So the branches that will give, so this will be going to the subscapularis, and indeed eventually it will form the scapular circumflex. So axillary artery will give, the important branches it will give will be the subscapular, it will also give, which will give rise to the circumflex of the scapula, and it will also give rise to a lot of divisions and a lot of branches to the scapula, both the anterior and posterior aspects of the scapula. It will also give rise to the circumflex of the humerus, and then give rise, when it terminates, give rise to the brachial artery as its and really the important aspect of this would be the superficial and deep muscles into the suprascapularis, superficial and deep suprascapular. So the important point to stress about the axillary artery is its important relations with the cords of the brachial plexus, or indeed the brachial plexus, because it does run with them, most especially as it emerges from the inferior aspect of the clavicle. It's also important in terms of providing branches to the scapula and the thoracic cavity as well, it will give rise to the internal thoracic. It's also important in terms of giving rise to the brachial artery, and which will then also give rise to the deep brachial and extending into the forearm. So this is the importance of the axillary artery, really, in terms of its anatomy and its anatomical relations, and the fact that it actually supplies the scapula, the thoracic cage itself, all the muscles in the scapula and thoracic cage. So it is an important, although it's quite short in terms of it arises from there and terminates there. I should really show things on the model. In terms of arising, there and terminating there, it has a very, very short span. However, it's quite important in the sense that it gives branches to arteries to the scapula, including the infrascapular, the circumference of the scapula, both the anterior and posterior surface of the scapula. It gives branches to branches to arteries of the muscles of the thoracic cage, and indeed the internal thoracic cavity as well. So although it is quite a short muscle, it also gives branches to arteries. Well, it also gives branches to arteries of the proximal humerus, which is the circumflex, and both the posterior and anterior, and indeed the accruciate, which lies in the entire tubercle of the greater and lesser tubercles. And again, it's important. The most important thing to mention about the accruciate artery is that it is one of those arteries that will become damaged when there is the trauma to the proximal humerus, together with the median nerve. So they are the two that are most at risk of any trauma to the proximal humerus. So now that I've also briefly touched on the importance of the axillary artery and how it arises and its important anatomic relations with the brachial plexus, I'm very, very briefly going to introduce a few pathologies of the shoulder, because really this part is perhaps the main part or the final part of discussing the shoulder, because when I move on to the next section, I'll be mainly focusing on the distal part of the humerus and indeed the forearm, and obviously the posterior muscles briefly. So the pathologies of the shoulder that can happen will include shoulder pain. And shoulder pain can arise from many, many underlying pathologies. We can also have osteoarthritis of the shoulder, particularly the glenohumeral joint. However, it's not very common. Osteoarthritis usually happens on the joints of the lower limb. However, we can have